Are we ready to go?
Mhm.
All right. Welcome everybody to the October 2nd meeting of the CoC board. It's an honor to actually be the one to get to say hello. Having just gotten elected, Ruby will be joining us shortly. She's on the way, but happy to go ahead and get started. I believe roll call is first. Alex, if you don't mind calling the roll.
Yes, please say present if you're here. Patricia Sam.
Present.
Thank you. Tamara Bellman.
Here.
Lise Castro. Oh, whoa, sorry. Jaja Floyd.
Here.
Dorsal plants.
Here.
Sorry, I just realized that my thing is not up to date. Martha Sassarosi.
Here.
Christina Sawicki.
There are
She's in.
go Dorsal.
She's in the public chat along with Bella. If we could get them promoted.
Thank you. Yes, I will.
Hello, everyone.
Okay. Elizabeth Moffin.
Present.
Stella Irons. TT White.
Present.
And
Victor.
yeah, Victor, sorry, I just realized this was off to date. Victor Liu.
Yeah.
Okay. Is there anyone else? Amaya Lenore.
Here. I'm here. I don't know if you guys can hear me. Sorry.
I can hear you. We have 10 members present, quorum is met.
Thank you, Alex. It looks like we're still transitioning. Amy, I saw you just put your hand up too.
Oh, sorry. Yes.
Amy Thomas here.
Amy Thomas. So sorry about that.
Welcome. We are very excited to have you here, Amy.
11 members present. Sorry about that, everyone.
All right. While we're shifting some people around and still getting people in the room, we'll go ahead and just keep moving. We've got a pretty tight agenda today, which I apologize for. We'll try and plan a little bit better so that we've got some breathing room, but we've definitely got a lot to do today, and a lot of it is important for the work happening in King County. So at this point, I will turn it over graciously to Elizabeth, who I believe will be doing our land acknowledgement.
The King County Continuum of Care Board acknowledges that we work on the unceded traditional lands of the Coast Salish peoples, especially the First Peoples of Seattle, the Duwamish people, the original stewards of the land, past and present. We honor with gratitude the land itself and the Duwamish tribe. This acknowledgement only becomes meaningful when combined with accountable relationships and informed action, and is the first step in honoring the land that we today sit on and their peoples.
Thank you very much, Elizabeth, especially for doing that last minute. I really appreciate it. So reading the theory of change, which we always want to center in the work that we're doing, if we create a homelessness response system that centers the voice of people with lived experience of homelessness, then we can focus on responding to needs and eliminating inequities to end homelessness. All right. I believe, let me make sure. We are at introductions according to the agenda I have, and is our special guest here? And yes, Bella is in the audience. Okay.
Yes, our guest is here.
Well, Wonderful. I am really privileged to have the opportunity to introduce Dr. Kelly Kinnison here to the CoC board. We are really excited to hear from her. I just want to do one quick note. As I mentioned at the beginning of the meeting, we've got a lot to get to today. And while this topic and discussion is really important, our hope is this is just the beginning of several conversations we'll be able to have with Dr. Kinnison. And so we'll be having more of a facilitated discussion. That's why we asked for the questions in advance. But any questions that you all have, we will make sure to capture and get over to her so that we can get those answers as well. But Dr. Kinnison, I'm very happy to have you, and I'm happy to turn it over to you now.
Thank you so much. I'm so happy to be here with you and really appreciate the invitation and also the sentiment that this is just the first of many ongoing conversations. You all are so important to the work we're doing, and we, even more so now than ever before, really need this board to be a conduit to expertise from folks who have living experience, folks who have lived experience, subject matter expertise, and all of your other rich experiences serving our unhoused population and other folks who are unhoused, unsheltered. And so really just appreciate making the time and your very busy agenda. So I am Kelly Kinnison, Kinnis as in Sam, O-N. Please call me Kelly. And I am 60 days into my tenure. It feels like 1 minute and also 1 year simultaneously. I don't know if you've ever had that experience. And I really appreciate getting your questions in advance. I apologize we don't have time today to dig into every question that you might have for me, but do commit to returning periodically and having other ways that we could get to communicate. So I don't know if it's best to talk about our perspective here in terms of what the 60 days, what we've learned and where we're headed. If you'd like me to jump right into the questions, I want to make this as useful to you as possible.
Hi, my name is Ruby. I'm sorry I'm a little bit late. I appreciate the grace there, but nice to meet you. Thank you for coming. I think I personally would like to hear a little bit about what you've learned over the past 60 days and just kind of get us up to speed on where you are in this very intricate puzzle that we're working. So thank you for taking the time.
Absolutely. I'm delighted to do that. So I really started with 3 main goals. One was to see how we were doing as an organization and make sure I talked to all of our staff and leaders, just figure out where we need to make improvements, where improvements were already underway, and where we needed to really step back and rethink our work. One piece of that was influential for me is, as many of you know, in a lot of detail, that we started, the King County and Seattle caucuses started to rethink our interlocal agreement before I arrived. And so was paying close attention to that process. We did get to propose some technical changes there, but really use that as a thermometer for where KCRHA is with our funders. As you know, they've shifted that board largely to our elected officials, which represent our funding partners, and then 3 seats for folks with lived experience. So that really was a clear signal, and in the conversations that I was having during my interview process, that they really wanted KCRHA to become a strong, healthy organization, laser focused on our core mission, which is to get unhoused people inside, and to think about the homelessness system broadly and start to have the credibility and the capacity at KCRHA to have those strategic conversations. And as I said earlier, I see you all as a key place where that can happen. I think the streamlining of the boards has good and bad facets to it. But I think the clarity it brings is really helpful to me as the CEO. one thing that I heard from a lot of partners about KCRHA is that we're exiting our startup phase. And I thought that that was a really interesting insight, that a lot of the challenges that KCRHA had are challenges you might expect from a startup, but it's really hard to be a startup and have public funding because, you know, the stewardship of taxpayer dollars is critical, and we never want to make investments of public dollars in things that are less than, you know, baked. And so I think that was a weird tension for KCRHA to manage in its first couple of years. And then you layer on COVID and other things, and you kind of get our infancy, if you will. So I like to think of, I'm a psychologist, right? So I think about developmental and life course kinds of things. And so developmentally, I think if we're not an adult yet, maybe we're you know, a teenager at least at this point, and we're learning lessons. And unlike teenagers, doing a lot of listening to folks like you who have a lot of experience with KCRHA and how things have worked. And that is the second pillar. In addition to having a healthy organization, I think developing that capacity to be a good partner and to have community engagement, not just something we add on to our processes, but that the way we do our work, the way we scope our work, the way we proceed in our work is in community, and that isn't one group, it's not one time. It's really just sort of a philosophy for how we do our work. Some of you might know that I had started Equity Technical Assistance Center at the Department of Health and Human Services at the federal level. And that was really the point of that, is like how, when equity became something we could talk about at the federal level with President Biden coming in, and such a big need for that conversation to be had in federal agencies. How do we make that not just talk, but actually something that folks can implement after this particular set of leaders is gone? And so we worked to develop tools and processes and policies that just made equity and ways of equitable thinking, ways of bringing in lived experience as part of doing that work, as part of the business process. And so folks could undo it, but it will take a lot more than someone, right, a leader leaving. And so that's really how I would like to see us proceed within this work, is to make community engagement and a big part of that, right, engagement with folks with lived and living experience baked into our business process. So it's just the way that we do our work, and they can put whoever they want on the board, and, you know, we can, you know, bring all of the expertise we have to the board because we have it in our everyday work and how we do our work. So that's the capacity that we've been building. And I think the response to a lot of the information gathering that I've been doing from service providers and other partners, just really wanting us to see a homelessness response system and not just a collection of providers doing their best. And how we build out that system, I think, is about our business processes and our engagement, the level of engagement and the kind of partner that we can be. So that's sort of what I've been doing. It's coming along. We are not there yet, but we are really grateful for the grace folks are giving us in terms of staffing, right? We know that if you're going to do things like community engagement and supporting people with lived experience to come to the policy table, that just, you know, doing that haphazardly is sometimes more harmful than helpful. And so you need staff to be trained, you need to be engaged in community and listening, and you have to have resources in place. And so there's a lot of call for action, and I hear it and I feel the urgency, and we're not going to do it in a tokenistic way. We're doing it in a very real and intentional way. And that takes more than 60 days. So hopefully that resonates a bit.
Yes, thank you.
Yeah, absolutely.
It's great to hear the kind of pathway to the today, you know, day 60, I guess, or day 61, I don't know.
Right.
That's really great. Do you have any questions for us? Like,
Yeah, I would love.
Oh, sorry, but I,
Dorsal has.
Oh, I'm so sorry.
Questions too.
Thank
my
you.
bad, I
That's okay.
apologize. I'm late, what can I say, that was my bad.
It's funny.
We definitely want to get to that question, but I want to ask one of the questions one of our board members asked, because it kind of ties into what you were just talking about in regards to how will you elevate the voices and the insight of folks with lived and living experience of homelessness, particularly when you're working with the mayor and the King County executive?
That's something that I feel, really dedicated to doing. Again, I think there were some concerns that I heard when the board sort of membership changed and the board structure changed. And knowing what boards are and how they operate, I hear those. And also, we have the power here at KCRHA to have it be so much more robust than just board seats. And so my plan is to have, again, these standard procedures that we have when we're developing a funding request for proposals, when we're thinking about doing debriefing on our severe weather program, when we're thinking about legislative action and how we want to advocate with our city and county partners and with the state legislature, that we have ways to have folks with lived and living experience feeding into those processes. And at those tables, when we go talk to our board, when we talk to our elected representatives, again, I think my commitment to doing that is very real. And that isn't something that I would throw someone into who didn't have right experience doing those things. And so we need to get there. We're not there today, but I think this community is so rich with folks who have lived experience, who are willing to participate with the process and with the system, that I feel really excited about moving that forward. A couple of internal mechanisms I would flag for doing that. One is we are hiring a chief of equity and inclusion and equity and impact as one of my direct reports, along with our CFO and our chief program officer and our chief of external affairs. So that person will be thinking about not our own KCRHA internal DEI work. We will have a staff member on our HR team to do that work. This is someone who's thinking about the system, right? And how equity is developing and we can be accountable for that in our system, and the impact that we're having on our communities. So our data and research team and our ombuds office will report to that chief of equity and impact. And so that is one key mechanism, I think, for holding every executive leadership team meeting, right? That person is at that table talking about community engagement, talking about lived experience, talking about our impact, what's our equity analysis of this issue. And so that was a really important step for me. I also anticipate having a role on that team. Right now, we're calling it a lived experience coordinator. This is someone who isn't they may, likely have lived experience, but they are not the person to provide that information. They are the person teaching all of us how to do that work with folks with lived and living experience in ways that are not tokenistic and harmful. And so there is a lot of that expertise around in the policy space. Many of you serve that, with the organizations that you're in. So that's really a liaison role, a capacity building role for us, so that we do that work in a really genuine and authentic way. So those are my starting gambit for how we hold ourselves accountable.
Thank you. And kind of tying back into your 60 days, and 60 days is not a lot of time. It can feel like it, but in reality, it's not. Were you able to visit any of the encampments or any of the safe parking sites that are outside of Seattle as part of your 60 days? And if you haven't had that opportunity, would you be open to a CoC board member or others potentially inviting you to some of our smaller local cities that are also dealing with some of the same issues Seattle is?
Absolutely. I am really anxious to be out in all of the communities that we serve across the county. I have spent most of my time in Seattle so far, although I've been to Auburn, and been to a couple of other places on the south side, attended meetings with some of our north side partners and east side partners, and going to the east side tomorrow. But certainly have just started to getting out and visiting actual service providers. So would love to take you up on that offer.
Yes, we're happy to connect you. And I think there's a lot of us that would love to show you our special parts of King County and the unique challenges that we have there. Going to throw in kind of talking more about that regional kind of scope and some of the challenges just that you're honestly walking into. Historically, there has not been a comprehensive strategic plan between the City of Seattle, King County, and the Washington State Department of Commerce, who is the primary funder for right-of-way and encampment resolution with KCRHA. What would your vision be to make this a more seamless and a coordinated or collaborative process?
Yeah, I've heard a lot from folks that they would love for KCRHA to have a kind of convening, organizing, strategizing role. And, we haven't necessarily had that capacity or that focus previously. And so, my first, quarter or so here, that's what I've been focusing on with external partners, is saying, hey, we are here. We are showing up, we are getting our house in order. And when we make commitments, we're going to follow through with them. And so we will be a credible place to have those convenings and conversations. And we have heard really great feedback about that. I think, it's not a one-time thing, right? It's in some ways the way we do our business, but I think we also need to step back and have a big picture conversation as an entire region about our system or lack of a cohesive system, and where the gaps are, and think about it from our clients' perspective, from a family's perspective. What are they experiencing when they have that moment where they need to be connected? Could have been, their situation could have been prevented, or it wasn't prevented and now they need to be connected to services, or now they're in housing, but maybe struggling and might need to have some additional support. Which of us in the community has sort of got that? Which of us is holding that responsibility, that funding, and how do we all work together to make this this cohesive in our region? Because I believe we have the resources to do it. I believe we have the talent and the passion to do it. And I think we need, to have some transparent and engaged planning activities, hopefully next year, to get us really started down that path together.
Thank you. And another question that I have, the theory of change is central to a lot of the work that KCRHA has done and committed to. It's essential to our work. It's why we read it at the beginning of each of our meetings. I would love to hear, that's the wonderful, public presented version of it, but I would love to hear what the theory of change means to you personally, and how that will guide our work as we begin to work together during your time as the CEO.
Yeah, so I'm a community psychologist by training, and community psychology is really about person-environment fit, and that people are agents in their environment and are also very much affected by their environment, which is made up of built places and systems and policies. And so I've spent my whole career thinking about public policy and social services with that lens. And so I think, in my mind, creating policies or programs or systems where the individual at the center of that is not an engaged partner and co-creator is kind of bananas. So it's sort of just been an orientation. So when we started having conversations at the federal level of, we need to include like the user and lived experience. And I'm like, wait, we're not? Like, what is happening here? So I've spent a lot of my most recent federal years catching the federal government up on where you all have been for quite some time and learning from local places that are doing this well in education and housing, in human services. Folks call it different things, right? But I mean, I think the fundamental value here is that, you know, could we possibly do something we think is going to be successful without centering the experiences of the people who it's intended to serve. So it's very important to me. It's sort of a central personal and professional value outside of this job. And then it was a key attractor to me for this job. And watching feds do this badly, I think I've learned a lot of lessons at that layer about, again, I've been in meetings where someone was invited to tell their story, and then they opened up for questions and there wasn't like language support, and this person needed language support, right? So like a national webinar where this person is put in this position, and like that should never, ever happen. Inviting people into, we're engaging people in research planning, but you haven't given them any foundation in why are we doing the research? Who decided to do the research? Who decided who's at this meeting, right? The table setting is as important as who's at the table. And so peeling back the onion is sort of what really excites me. And I think that's the journey KCRHA is on, is not, how many seats on the board, or did we do a listening session? It's who's setting the table and at the table for the system design work. And is everybody, do we have equity in how people are prepared to engage in that work and how their voices are lifted up? And then clarity and authenticity about who the decision makers are, because we can want it to be different all we want, but our funders make a lot of decisions about budget lines and things like that. And so we need to work within that. And if we don't acknowledge those realities, then we just, have chaos. So there's a dose of realism, but also a deep commitment and hopefulness that we can be really impactful together. Elected leaders, if we come to them as a block, right, have a hard time turning us away. So that's my goal.
Thank you. And I think you have a room here full of people that are eager to help peel that onion and actually really start to see some of the results that so many of the people we know personally need. It might be a great time for Ruby's question, if you want to go ahead and ask it again about how we can work together.
Yeah, I guess that would lead it to me on this point now. Thank you so much for giving me that grace again. Yeah, I'm glad you used the onion reference. That's one of my favorite concepts of this system, is an onion, and peeling it back makes you cry a little bit, the whole 9 yards. So thank you for that. Just how can we help you? Like what sort of things are you looking for from the Continuum of Care Board to be more, because I think we'd love to see, everybody here wants you to succeed. We all want the KCRHA to succeed. We want people to be in housing, and we want our city to have, or our region, our region to have a more better understanding of the situation. And so how can we help you communicate those different things to our communities, and, what other things can we do for you?
So a couple of things. One is, I think part of an equitable system is understanding that the system works differently for different people. And so that is what, in 2024, I think we need more emphasis on. Who are we serving well? Who are we missing? Who are we serving, but not really in like a culturally appropriate, ideal way? I think that's where you all have a lot of expertise and can corral expertise to share with us. And then work together and be solution focused on that, right? We have every intention to move toward the solutions to those issues and not replicating them in our system. And it takes time. So helping us message that, helping us get the information we need, which is real time. That's changed. It's different than it was 2 years ago. And in 2 years, it'll be different. So it's not something we can do one time. And those of us who have experiences in different cities and different sectors, like helping us stay focused on that we are a regional system and we are a set of places in the region that are different. And that place-based approaches are really important and don't take away from, but actually add up to a really solid regional system. So again, want to get out and see more of the region as I spend more time in this position, and need voices saying that sounds great and you're going to need to do something different in this community because it's not this, it's not the same. And so how do we figure that out together?
Great. Yeah, I've lived here for 33 years, so it's interesting to hear, like it's definitely different in different places. So thank you so much for being observant of that. Thank you. Thanks for meeting with us today. We really appreciate it.
Yes, thanks for having me. Again, I know you all have a lot going on and a lot of work to do together. And I would love to come back soon after a few more days on the job. But we will begin engaging you, through our fabulous liaisons to pull you into these community engagement plans and help us think through making those plans and probably all kinds of other things.
Oh, we'll find a way.
Okay.
Yeah, great. Thank you.
Thank you.
Thank you so much.
Okay, I'm scooting. Bye.
Thank you for coming.
Thanks so much.
Thank you. Have a good day. Right. Yeah, I apologize for being late. Phone issue.
It's why there's two of us.
You are a human being.
That I am. I didn't think I was for a while, but I guess I am. So, we did it. We met the CEO. So the next thing on the agenda is the break. Perfect timing on that. So,
We did not vote to approve the last minute's meeting.
oh, we didn't. Do you want to do the housekeeping first then?
Should we do that really quick and then?
Yeah,
Go into
we,
the break?
we have time to do that. It's after the break, but we
Oh,
definitely.
it is. Oh, I'm sorry. Let's just wait until that then.
Okay. No worries. So we'll go ahead and do the housekeeping when we come back, and we're gonna take a 5-minute break, and come back at what, 2:38? Is that the right math there? Okay. All right.
Yes.
Thank you. See you guys at 2:38.
Bye-bye.
All right, thank you guys. That was our short break for the CART captioner. I just wanted to remind everyone and myself that we should say who's speaking. So this is Ruby speaking, and to try and keep it slower so they can, we'll be able to type the CART captioning correctly. Okay. Thank you. Now we're moving into the meeting minutes approval. Do I hear a motion to approve the meeting minutes from September 2024?
So moved.
Okay. Do I
This
hear a
is
second?
Martha, second.
Thanks, Martha. Any discussion? Any edits that need to be made to the minutes? No, not hearing any. I guess that moves us into a vote. Alex, do you mind doing the roll call?
And I have the correct names of this time.
All right.
Patricia Sam,
Patricia, Sam, accept.
thanks Patricia. Tamara Bellman,
Approve.
TT White.
Approved.
Jaja Floyd.
Approve.
Thank you. Bella Irons.
Ella Irons, approve.
Dorsal Plants.
Dorsal plants, approve.
Ruby Romero.
Ruby Romero, approved.
Martha Salcerosi.
Approve.
Christina Salke. Christina.
Maybe she put it.
We'll come back at the end. I'm kidding. Elizabeth Muffin,
Elizabeth Moped, approved.
Amy Thomas,
Abstain.
and Maya Lenore,
I abstain.
Victor Liu.
Victor Lu, approve.
Okay, Christina Salke, do you approve the meeting minutes from last month? Right, with the minutes are approved.
Great, so the meeting,
10,
yeah, 10 yeas, or 10 approval of the meeting minutes are approved for September 2024. And that's the best ringtone ever. I like that one anyway. So, also I wanted to mention, Victor, did you get a haircut? It looks great. Sorry.
I did, thank you.
Yes, absolutely. The next thing on our agenda is going to be the public comment. I know it's a little bit later than we usually do, but thank you for taking or making time for the CEO to have a robust conversation with us. If there is anyone from the public, if there's anyone from the public that would like to make a comment, go ahead and raise your hand. We don't have anyone here in the room. So we'll just see if anyone has their hand raised for public comment today. That's the second time I'm asking. All right, this is the third time I'm asking for anyone interested in giving public comment to raise their hand. Not hearing any. I will just remind everyone that they are able to put any questions they'd like in the Q&A, and we can either answer it in real time or put it in the parking lot to be answered next month in meeting minutes. And that'll move us into the next section, which is Kelsey, I believe, is going to go over the review of the project priority listing for fiscal year 2024. This is for the NOFO process, and we're gonna be voting on it afterwards. This is gonna be the rating and ranking process, or not process, excuse me, the rating and ranking tiers of the programs for the CoC funding. Kelsey, take it away.
Thank you so much. Hello, everyone. Kelsey Beckmeyer, she, her pronouns. I'm a program performance manager with KCRHA. I am off camera today as I am not feeling well. So please pardon me on that. I am going to pull up my screen to share my, oops, here we go. All right. So we are going over the fiscal year 24 CoC NOFO priority listing recommendations. This is for the fiscal year 24 CoC NOFO. This is the application that is due to HUD at the end of October. And the first part of this is the priority listing. So today our objective is to do a bit of an overview of CoC funded programs. We will review the rating and ranking process. I will be presenting as well the priority list for the board to vote for approval. So the aim is really to provide all of you an overview of this process and how we are prioritizing or recommending to prioritize submitting the list of projects to HUD for both renewed funding and new funding. So first, a little bit of an overview regarding the funding available and what we are doing. So for fiscal year 24, the CoC NOFO, I have up here some numbers. And first we have the estimated ARD or annual renewal demand. This is the estimated total that we have available from HUD to be renewing. They break this down into a couple categories. One is tier 1. Tier 1 is just over $53 million, and this is equivalent to 90% of our annual renewal demand. That does not include youth homelessness demonstration projects. Those are non-competitively renewed, so are not included in our tiering process. This 53 million is kind of our guaranteed renewal amount. The remaining amount is tier 2, and this is the difference of tier 1 and our maximum available amount of remaining renewal money. Any dollars we would reallocate, our CoC bonus funding and DV bonus funding. So that is what this overall total is for tier 2. This year for the CoC bonus, we had $7.5 million available. And for the DV bonus funding, we had $2.6 million available. We then have our CoC planning funds, which is $1.5 million. So we had to do two things with the priority list. We first had to rate and then rank. So rating is scoring all projects based on standard criteria, and ranking is prioritizing those projects based on our local priorities. And this is based on our priority and value document that was approved by the board back in May. The ranking is done after the rating. If the rating panel believes that there is a program that is rated lower, that based on our local priorities should be moved higher in the rank order list. This year, all projects were put forth based on their scores. A little overview of our raters. First and foremost, our raters carry so much of this process. We cannot complete this without the raters, and just a deep gratitude to everyone who put in a really amazing amount of time, energy, and really careful thought into reviewing all of the applications. Our raters are really the core to the whole priority list. This would not be possible without all of them. So just a really deep thank you to everyone. This year we had 14 raters. Raters were chosen for their subject matter expertise as well as lived and living experience of homelessness. Raters initially attended or reviewed a 2-day or rater orientation training, which included an implicit bias component and how to evaluate the applications and particular sections such as housing first, low barrier services, etc. Raters were all given scoring rubrics and criteria to help maintain scoring consistency and objectivity. And we had over 5 hours of debriefing and reviewing all of the applications to make final rating and ranking decisions. So again, this is no small feat. I believe there were over 75, I want to say, individual applications that were read and reviewed in a 2-week period. So just the volume is extensive, and huge thank you.
Really quick, thank you, Kelsey. I just see Tamara's hand. Did you want to take questions now or after the presentation?
I have space at the end, so I will do questions at the end.
Okay, yeah. Thank you.
I don't think my brain can like bounce back and forth very well today. So
understandable. I'm sorry that you don't feel good, Kelsey. Thanks for doing this for us.
Of course. So a little bit of a timeline just to provide some context into what was happening behind the scenes. So the application deadline for both all of the renewing and new applications was August 30th. The rater application reviews, if we could please mute the room. Thank you. The rater application review period was Wednesday, September 4th through Friday, September 23rd. And I think that's actually a Monday. It was a Monday. We then had a rater debrief on Friday the 20th, as well as Monday the 23rd, to kind of do a deep dive into scoring and the final ranking list. The priority list and this presentation was sent to the CoC board last Wednesday, September 25th, with aiming of doing approval of the priority list today, October 2nd. And kind of the next steps after today is that we will be sending out award acceptance or denial notifications by October 11th. And we will also be holding a community meeting on October 11th to do a final review of the published rating and rank list. This list has to be publicly posted and shared out publicly by October 15th. This is a HUD-driven deadline. We are required to post it 15 days before the application is due to HUD on the 30th. We will be submitting the full application of both the priority listing and the consolidated application on the 30th, and we have to publicly post all of that on the 28th. And I'll get to some next steps at the end. So a little bit around like new projects versus renewal projects. So new projects, these are really projects that either do not have current CoC funding, or it's an existing CoC funded project that wishes to expand its funding. There's more detailed criteria and review that is required for new projects. And all new projects were reviewed for program type eligibility based upon HUD guidelines and the posted request for proposals. Renewals are all currently funded CoC projects. So these application scores are combined with HMIS data-driven scores. So they have both a written application and HMIS data that drives those final scores. The eligible program types for new funding this year included permanent supportive housing, rapid rehousing, joint component And this is transitional housing and rapid rehousing. Both must be provided in a joint component. Support services, coordinated entry, and HMIS. I'm going to just do a very quick high level of what each of these program types is. And this was what was put into the RFP and shared with all of the raters. So permanent supportive housing is deeply affordable, long-term leasing or rental assistance with supportive services that are provided to households where at least one member has a disability. Eligible participants must be experiencing chronic homelessness for CoC funded permanent supportive housing. Rapid rehousing is a permanent housing option that is providing short to medium term rental assistance. So it can be up to 24 months of rental assistance paired with support services. So rapid rehousing programs must offer both the rental assistance and the support services. Participants are also required to meet with a case manager at least once a month. The next type is a joint component, transitional housing and rapid rehousing. This is a project that combines both transitional housing with rapid rehousing. So it is offering a combination of both project types in one. Participants may decide what that looks like, whether it's just transitional housing, just rapid rehousing, or a combination of the two in any kind of time combination up to 24 months. But again, it has to have both those components to be funded by HUD. Support services only coordinated entry. This is to enhance our coordinated entry system and navigation supports to folks who are unsheltered. And the support services only is just that. It is conducting outreach to sheltered and unsheltered individuals and families and providing referrals to housing or other services. If someone is doing support services only, they cannot also provide housing. It has to just be the support services. So those are some of the requirements per HUD. Finally, we have the Homelessness Management Information System. So the HMIS component allows HMIS lead entities to operate that database system and to enhance our database system as well. So a little bit around our just summary of our final recommendations for rating and ranking. In tier 1, so in that $53.3 million, we recommend 43 projects to have one project that is straddling tier 1 and tier 2 due to the available dollar amount in tier 1. We had to put some of the funding for a project in tier 1 and the remaining amount in tier 2. We do see more projects in tier 2 this year because the tier amount in fiscal year 24 is only 90% of the annual renewal demand, where last year it was 97%. So the tier 1 percentage decreased this year overall for HUD. You will see unrated projects in tier 1, and these were placed in tier 1 because they are either required projects, so HMIS is required by HUD, coordinated entry is required by HUD. So those were placed in tier 1 due to risk of defunding. We don't often see defunding in tier 2, but there is always a risk. New projects that are renewing but don't have a year of data or they started late in the year were also placed below the lowest rated of the same program type. So for example, you will see a permanent supportive housing program that is a new program that did not have a year of data that we looked at, and it was rated 1 below the lowest rated permanent supportive housing program. This is a practice that we have carried forward over the years as well. In tier 2, we see 11 renewing projects. Again, there's the one project that is straddling tier 1 and 2. And decisions for what was in tier 2 was really led by the overall program score. A little bit now about the CoC bonus. So for the CoC bonus, we saw a total of 10 projects apply for funding. The total request for funding that we received was $10.4 million. The total available was $7.5 million. So we had over almost $3 million requested than was available. So raters had to make some decisions looking at new projects about particularly looking really closely at program type. So did they fit any of the allowed program types? And then looking at rating and what the rating panel wanted to fund and move forward. Ultimately, 8 projects met threshold for funding and were fully funded based on the available bonus amount. 3 of the projects were the like program type and will be combined and applied for as one. And this is kind of a funding strategy to hopefully get all of those funded versus 1 or 2 of them. In the IPVE or DV bonus, 5 projects total applied for funding. There was a request of $3.9 million, and we had available $2.6 million. So we had a little over $1 million over the available amount was requested. 4 projects met the threshold for funding and were selected based on the available bonus amounts. The rating panel did decide to move all 4 projects forward at a reduced request amount. And the reduction was decided upon based on the amount of the percent of the total they requested was equivalent to how much they were reduced. So for example, if a project requested 30% of the available total, their project was reduced by 30%. In putting forth the application, we will also do a reduction in how many they're anticipating serving so that they are set up for success and not set up to serve more people than they'll be funded to serve. So there'll be some right sizing of those projects in the application process. A little just final overview. We have a total of 56 projects that are renewing their funding, 6 new projects because we are combining 3 will be put forth for the CoC bonus dollars, and then 4 new projects will be put forth with the DV or IPVE bonus dollars. The total request that we are putting into HUD is just over $74 million. Aside from the vote today, I also want to do an overview of the next steps as well. So there will be a special meeting on October 24th at 3 p.m. This special meeting will be to do a review and approval of the collaborative application. This is the second part of the NOFO application in total. I'll also request a review of a lived experience letter of support that I've floated with the co-chairs. Meant to dive into that Monday and I was out sick, so we'll address that next Monday. And then we will be sending a full draft of the collaborative application to the board by October 18th. We are working to get that as fully completed as possible by the 18th. And then it must be approved and publicly posted by October 28th. So just overall, both the priority list and the collaborative application are due to HUD on October 30th. So we have 28 days. And now I will, before I take questions, I'm actually going to pull up the actual priority list to show you what will be presented and posted to HUD. So this is the priority list itself. Let me get my mouse so I'm actually able to better show you this. Oh my goodness, pardon me, y'all. Let's zoom in a little bit and move over. No. Okay, we're just going to stick with this. So what we have to present to HUD, we have to send in a list to them, an attachment that includes the tier that the project is placed in, their overall rank, the project name, their score, the status, if it's accepted or rejected, and then we add in here the project type and the aggregate total we add in. We also need to put the total amount that's being requested from HUD. So in tier 1, you'll see a lot of our permanent supportive housing programs. These are permanent units that some folks may have lived in for decades. So we really want to make sure that those are prioritized for funding. Again, you'll see here that we put our required components from HUD, so HMIS and coordinated entry are placed in tier 1. And the other piece that I wanted to just highlight, you'll see a new project that were not rated are placed one below the lowest rated of the same project type. So we have tier 1, that's the total of 53 million. In tier 2, we have all of the other renewing projects. And then we put in our tier 2 CoC bonus projects, tier 2 DV bonus projects, and then the YHDP projects, the Youth Homelessness Demonstration. These are not competitively renewed, so they are not rated or ranked in the same way. We just put those forth in its own area. And then we include the projects that were not selected for funding based on not being within the program scope. So this is what we will be asking you all to vote on, and we'll be posting then publicly and submitting to HUD. I am going to stop sharing my screen for questions just so I can see you. So questions? And Dorsal, I see your hand.
Tamara did have a
Yeah,
hand
go ahead,
up
you got
first.
it.
Oh, mine was an accident. Sorry. I put it down.
Thank you. The question I have is actually from Christina. And before I answer that, I do want to acknowledge that we do have a couple of questions in the Q&A for Dr. Or Kelly, as she asked to be referred to. So we'll definitely follow up on those. And I know I have an email out to the chair of the Lived Experience Coalition, hoping the co-chairs will also be able to meet. So Christina asked, how come the CoC never hears about or works with veteran housing dollars or NOFO? Christina identifies as a homeless veteran.
Yep, that is a great question, Christina. Thank you for raising that. So the reason that it's not with the CoC is that HUD has like other specific pools of money dedicated to veterans who are experiencing homelessness, and largely due to having other funds and other pools of money that's really specifically dedicated to veterans, the CoC is not focused on veterans and looking at other populations who are also experiencing homelessness. So that's really the reason that I am aware of. I'm not aware of other like particularities about why veterans are allowed to be served with CoC funds and projects can focus on veterans. That is a population that can be focused on. And due to also having very dedicated funding sources with HUD, it's not the primary focus of the CoC funding. Amy.
Sorry if you've already answered this because I missed it, and I apologize if you did. How does the tiering work? Who gives the input regarding what the best experience, or how are they ranked? How does that formulate? If I'm making sense. Thank you.
You are. So the tiering amount that's set by HUD, and what projects fall into the tier is really score driven. So we are looking at the rating and ranking criteria. This was criteria that was brought to the board. It was updated back in July, I want to say, if I'm remembering correctly. And this criteria looks at system performance, so program outcomes, how many folks are maintaining permanent housing or exiting to permanent housing, data quality. So how good is the data that's being put in? What are connections to income? Other ones are not sparking in my head right now, but those are some of the HMIS driven data components. And then the application that was due on the 30th, this is really looking at narrative responses related to system priorities such as housing first. How are you following a housing first model? What are your termination policies? Low barrier housing. How are you ensuring that folks who have high barriers are getting equal access to programs and working with folks to have access to programs? We have questions around racial equity and how folks are prioritizing lowering racial discrepancies within programs and access as well as terminations. We also looked at and had criteria relating to inclusivity policies, particularly for trans individuals and households. So all of that was laid out within the application and the criteria. So folks who have like strong system performance, strong outcomes, high utilization of their programs, as well as strong alignment with all of those priorities, land in tier 1 typically. And the threshold is really driven mostly by the amount of funding available that is in tier 1 versus a particular like score threshold. So there, hold on, I'm going to pull up in front of me. So if you look at the scoring, the lowest tier 1 projects scored a 67.5. And the one above scored a 68, and then the one below scored a 66.5. So scores are really pretty close around the tier cutoff. That's really driven by the amount available in tier 1.
And your screen stopped sharing. So we didn't see the information that you just showed. Thank you. This is Amy speaking. Sorry, Kelsey. Thank you.
Yep. So that's what I was talking to. So here we have the rank scores. So what's placed in number 43, their score is very close to, sorry, I'm just like clicking everywhere. Scores are quite close in this area. So really what's driving it is this total amount available. We can't put more than this $53,300,251 in tier 1. And that's the biggest driver because there was not an identified like score cutoff to go into tier 1. And part of that is we don't want to, for example, if we had a score cutoff of you have to have a 70 to be in tier 1, we would be doing ourselves a disservice because we'd be leaving $3 million out of tier 1 and putting that in tier 2. Tier 2 is the more like nationally competitive dollars. So we really want to make sure that we are leveraging this amount as much as possible to ensure we're getting as much in that tier 1 as we can.
And at what point were we, because I'm sorry I missed the meeting in September, at what point were we given this information as the board? Is this your first time showing us today, or did we have this information prior?
Yeah, this information, so this list and the presentation was sent to the board a week ago. The NOFO is very, very fast. So this list was completed the day I sent it to you all. This is one of the challenges with the NOFO is we are going to send you information and ask you to review things really quickly. The consolidated application is going to be the same way. It's going to be a large document that we are aiming to send as full of a version on the 18th of October. And it has to be posted publicly and approved by the 28th. So we have a special meeting on the 24th. So NOFO season is lightning speed.
And this is Amy again. I do recall you saying that it was going to be lightning speed, and it is my fault. Again, I apologize for the technical difficulties. Something, however, that's helpful for me as a learner, even though we're going at a fast pace, If there's a criteria that explains tiering or scoring, as a board member, I would appreciate that information so that I can feel that I am making the right decisions on the behalf of the community. And it's not just regurgitated information that's shoved at me quickly and then, hey, trust me, this is what we're doing and this is the process. So just so you know, and I don't know if that came out appropriately, but I just want to make sure that we're doing right by the community and that I'm fulfilling my obligations. So that would be helpful for me to know those criteria again, to make sure that this list is something. My concern is that if we're going off of the political knowledge of what works well, we don't want to leave dollars on the table, but there are better programs that are fit better for the community because they're the ones who are experiencing it. I would like to be able to capture that information or understand better how that kind of works. So thank you for letting me give input.
Of course. Thank you, Amy. And so part of this list was developed by our raters and rankers. So they were the ones who were trained about the criteria, given all of the materials. So they are the ones, KCRHA staff does not rate and rank, it's all community members. And they were the ones who really helped drive this final list. In providing the list, moving forward, we'll make sure to include those criteria. And with new board members coming on, it was something that kind of missed my radar since the criteria had been reviewed and approved by the board back in July. That was prior to new board members coming on. So that's a definitely a really great point to highlight, Amy, and I really appreciate you raising that.
And thank you. Again, this is not a character assassination or saying that you guys are doing anything ill, but again, for me to vote on things and be able to give information, it just makes me feel better. So thank you again.
Absolutely. Absolutely. I do see a hand in the room.
And regarding Uplift Northwest, there was a question as to whether they were service only and whether they had a housing connection with Kasota House. Were the staff able to resolve that?
Yep. So in review of the application, the request is just to do outreach services. So there's no housing tied with the application request.
Okay, so the organization can do housing and still have a service only application.
It's the particular funded program only. So this program.
That's helpful.
Yep.
We have a couple more questions in the room.
Yeah, I also see Dorsal's hand and I want to make sure we get to them as well, but quickly, do you mind sharing a little bit about the CoC planning funds? Is that something we could talk about at this portion? Because I saw it was mentioned and just was kind of curious as to like what kind of things go into that. We could maybe talk about it at a later time, but.
Yep. So this is a grant that helps to fund staffing at KCRHA as well as some of our governance responsibilities. So we are looking at what this needs to look like, especially so there is funding for CoC convenings, as well as for some stipends that are offered for folks with lived experience. So that budget is being worked on as we set it up, but it also is dedicated to make sure that there is appropriate staffing levels to do some of the administrative duties to have related to the CoC. So that budget is being looked at by our CFO and our Chief Program Officer.
Okay, great. Thank you for that. TT?
Yeah, hi Kelsey. Sorry, this is TT White speaking. I was just curious about the rating and ranking process. Was it completely objective? Like, just because I'm not familiar, I didn't see how applications, I didn't really, and that's on my part, I didn't take the time to look at the application process, but was it completely objective for the raters and rankers?
I will say, as humans, nothing is completely objective because that's the human nature. But I am pulling up right now the criteria so that you all can see what that criteria is. Just one moment, please, as I get all the docs up.
I don't know. Yeah, after.
All right, so let me share my screen with you all. So this is the renewing criteria template. So what we look at is movement to housing. This is based on HMI.
Your screen is not being shared. Try and refresh it, please.
Oh,
Thank you.
I didn't hit the share button. Clicked it, didn't hit it. So this is the renewing project rating or criteria. You will see that we have the topic, the score ranges, the maximum points allowable, the score, where the score comes from, so either HMIS data or the written application, and then what the, place for the actual score. So we look at movement to housing. This is based on HUD standards, and either you can meet expectations nearing a goal or don't meet a goal, and these are detailed as to what full points are, based on 50%, 80% target rates. We have extent of maintaining housing, extent of exits to known destinations, extent to exits to permanent destinations. We have data on income progress. Again, all of this is from HMIS, so the homelessness database, and from blah, blah, blah. I think my sickness is a little catching up with me, y'all, so please pardon me. I need to go a little slow. The next was around percent of individuals who are enrolled from streets or emergency shelter. We then look at HMIS data quality and completeness. And then for the application questions, we include here program component priority. So there are points based on the program type that someone is doing, the population they are serving. There are points dedicated based on population. And we also do note out the criteria of like how to apply the information. For the housing first narrative, we provide scoring criteria. And for some of the housing first, we also walked through that in training with all of the raters so that folks could have other materials. So we also provided them links and materials on what HUD standards are, where to review secondary information. I have a Teams thing popping up, my goodness. So there was housing first, then we looked at program termination and low barrier housing. Again, detailed criteria of what a 5, 3, and no points would look like to provide examples. And that was done also for the participant engagement and feedback, for the living experience. There were bonus points around board seat information. So all of this is really, we try and make it as clearly objective in the criteria as possible. And I'll just give you a view as well of the new project. So this is the criteria that was put out for the DV bonus projects. We look at the need for the project and the project narrative, and have pretty detailed criteria that we include. We have a bonus looking at jurisdiction needs, or the location of the project, and getting a bonus if we are in need of that housing type in that jurisdiction. Spoiler alert, there's not a lot of jurisdictions where we don't have a housing need. We have the quality of the project application and experience and system coordination, and we have kind of the detailed criteria as well. We have a demonstration and commitment to advancing race and social justice, and detailed criteria, and then we break everything down by low, medium, and high, and ranges for folks. As well as the demonstration of inclusion of victim service-centered practices. This is particular to the DV programs. The housing first and low barrier services, data and fiscal management practices, and then the project budget. And all of this, folks, were also provided with like a how-to guide. So I walked through all of the rating and how to evaluate things, and how to complete rating forms.
Kelsey.
Thanks, Kelsey. Dorothy, do you want to?
Yeah, two things. Just one really quickly for our newer board members. I really want to uplift that the rating opportunity is a really amazing volunteer opportunity, and so I highly recommend next year, or if it's not next year, the following year, participating. I learned better by doing, and so being a rater really helped me better understand the process. We do have a question from the member of the public that I thought would just be a quick clarification. And they acknowledge they might have missed it, but will the NOFO scorecard document, which I believe the priority scoring list that you've been showing us, will that be made available to the public, and when will the public be able to see it?
Yep, those are in the application. So all of that is on our website already with the RFP announcements and the applications. And all of this will also have everything like cleanly posted on our website as well with the priority listing.
Thank you.
Yeah. I just wanted to maybe offer some clarification too about there was conflict of interest forms that were signed and people were able or would recuse themselves from participating in rating of their organization. So I just wanted to highlight that as well. Hopefully that adds a little context there. Thank you, Kelsey. Is there any other questions for Kelsey? Not seeing any.
This is Amy Thomas. I just wanted to thank Kelsey. I know this has got to be so hard to be grilled and going through all of that while you're not feeling well. So thank you for taking the time.
Of course, of course. It's great to get your questions because it also helps provide feedback into how to make this a better process, not just for the NOFO overall, but for you all as the board to ensure that, we're providing everything that you all need to be as well informed as you possibly can be.
Speaking of being well informed, I think, does that move us into a vote? Or no, I'm sorry. Do I hear a motion? Do I hear a motion to affirm this rating and ranking list for the NOFO 2024? Right?
This is Martha, so moved.
Second.
Seconded. Okay.
Who seconded?
That was Tamara. Tamara seconded. Are you muted? Okay. Any discussion surrounding the of the project priority listing for fiscal year 2024? Any discussion surrounding that? No, not seeing any. Let's move into the vote. Do you want to do the roll call, Alex?
Yes, I do.
This is so this is voting for the project priority listing fiscal year 2024 for the NOFO. Just to be clear.
Okay, if you if you approve, please say yay, nay, or abstain. Well, those are the options. Patricia Sam,
Approve.
Tamara Bauman,
Yay.
TT White,
Yay.
Josh Fuller,
Yeah.
Bella Irons.
Yeah.
Yay.
Dorsal Plants,
Yay.
Ruby Romero,
Yes.
Martha Sacerosi,
Yay.
Christina Selwicki. Sorry, give me 1 second, let me double check. Christina Selwicki, do you approve? Okay, I'll come back.
For the Q&A.
Yeah. Christine, you want to put your answer in the Q&A? We'll come back to it. Elizabeth Maupin,
Yay.
Amy Thomas,
Amy Thomas, yay. Thank you.
and Maya Lenore.
Yay.
Victor Lu,
Victor Lu, yes.
Christina Sawicki. Do you approve? Good.
Put it in Q&A.
Yeah, she did not put it in the Q&A chat, so, okay, well, we can see if that comes in later.
I'll
but,
text her.
But right now we have 11. We have 12 yays. 12 yays. 12 yays. Motion is passed. All right, the 12 yays, the motion to approve the project priority listing fiscal year 2024 for the NOFO is approved. Thank you, Kelsey, for giving us that in-depth report out, and we're excited to move forward in the NOFO process and get that turned in on time.
Awesome. Thank you all so much. You will be seeing me again shortly, and we'll get the collaborative application your way as soon as humanly possible.
Feel better.
Thank you.
Don't focus too much on that. Feel a little bit better first. Okay, so that we're actually doing pretty good on time. We're moving pretty quickly through our agenda. And I don't want to put Monica on the spot if they are not quite ready, but if they are here and ready to, cool, let's go for it. Monica, I think we believe the next thing on our agenda is the application for the CoC Builds Grant. And take it away, Monica Gross.
Hi, everyone. Can you hear me?
Yeah.
Great. My name is Monica Gross. I'm the Director of Planning and Special Projects. I go with she, her pronouns, and I'm here to talk. This is just informational. No vote is required, but I'm here to talk about the CoC Builds grant that we're applying for from HUD. This is separate from everything that Kelsey is doing. So this is a completely different grant opportunity, and it's for a capital project for permanent supportive housing. So it's actually to build a building for permanent supportive housing. It's a very unusual HUD grant. There's hardly any that are for capital projects, but this one has come through because there is such a need for permanent supportive housing. The grant, we could get up to $10 million for a single project, a single building. There are a ton of criteria of what this building can be. It has to be a project that's already being built. It has to be a project that is already has a bunch of capital funds already given to it from lots of other different places. It has to serve a population group that has disability. They have to use coordinated entry. They have to use HMIS. So very, very specific criteria for the building. Right now, we have our friends at King County who do most of the building of capital projects for permanent supportive housing, very carefully going through all the projects that are being built right now to see that if we have one that meets this very, very strict criteria. I do not have an update of which building it's going to be because we just haven't figured that out yet. Because the criteria are so strict. But I just wanted to let you know that we're working hard to figure this out because we don't want to lose this opportunity. It's 10 million bucks, so it's worth the effort. The other grant that is going along with this grant is a $2 million grant, and it's for a tribal agency that's also building a permanent supportive housing building. And we do have a tribal entity, Muckleshoot, that is in the process of building a permanent supportive housing building that meets these very specific criteria. And so we are proceeding to put that project through for the $2 million. We do know that that one looks like it's going to be able to meet the criteria. So I just wanted to, I did include a memo in the board packet that gives a link to the documents about the grant, but I just wanted to let the CoC know that this is a CoC opportunity that we're going for. Once we figure out which building it is that we're going for, we will write the whole narrative for the grant. The grant is due November 21st. The grant does not require the CoC board to vote. But it does require the CoC board to sign a letter that says, yes, we support putting this grant in. And I will bring a letter to the board to your November meeting that says, we found a building, hooray for us. We're going to put forth this application for this $10 million plus this $2 million. So really, this is just informational. I just wanted to keep you guys all up to speed on exactly what's happening, and answer questions.
Dorsal? Or did you have a
Thank you.
Go ahead.
Sorry,
Dorsal.
Dorsal.
I just wanted to say I'm excited. This is
Yeah, it's really exciting.
Allow the Debbie Downer of the group. This is a great opportunity. I'm really excited about it. I'm just curious, and it might be a challenge to answer to this, but right now it sounds like we have a pocket of funding that has very strict criteria. So we're shopping for a program to meet the need. Is there, I guess, what is the process if you find multiple programs in King County that would qualify for the 10 million? And what are also kind of, I mean, you find one project, but the outcomes for that project or that the viability of that agency isn't there. Are you still going to go for that 10 million? That's kind of my two questions.
Yeah, I think I understood what you're saying, Dorsal. So I'll try and answer it. If I don't answer it, just ask me more questions. So one or actually a few of the criteria is that it be a program that has historically been successful. So they have to have, I think it's 4 previous permanent supportive, which is a lot, 4 previous permanent supportive housing projects under their belt that they are running smoothly, at least 4. So that was your first question. So we won't put forth a project that doesn't, we're going to put forth the strongest project we can. And we do have in King County some providers that, over and over again have built permanent supportive housing buildings and are doing it well. So we expect that we will have a provider that we can put forward that meets this strict criteria. But you're right, if we didn't have a provider, we wouldn't do that. And just to be, I want to just be super clear, this is not for a program. This is not operating expenses. This is just to build the building. It's just bricks and mortar. That's what this grant is for, $10 million to build a building. It's not going at all towards operations. Does that answer the question?
The other one was if you have multiple capital projects that would make, like, how are you deciding between multiple capital projects?
I don't think we're going to be in that position, but if we were, then we would probably come to the CoC board to help us sort it out. I honestly don't think we're going to be in it because it's such strict criteria. So as we're going through the list, it's looking like we're lucky we're going to have one, I think. But I would consider that the next step would be to bring it to the CoC board for sure. That makes sense. This is such an unusual grant. We're just going to literally put forth the program operator that has run the most types of these programs, that has built the most of these buildings, that has shown the most success, because it's such a competitive grant to get any opportunity to get it. We're just going to have to put our absolute best provider forward.
Thank you.
Yeah. Any other questions? I see Bella. Bella, I just have to say one thing. My maiden name is Irons.
Oh.
So we can go offline at some point and talk about Irons history. Anyway, go on. I'm sorry.
Absolutely. Thank you for presenting this opportunity. 2 question. First of all, you have mentioned that this is new. Is there any indicator that this is going to be a continued opportunity every, so many years? Do you know anything about the history as to why this came up or why it came into our purview right now, to look at preparing for any kind of subsequent, grant applications in the future, especially if we only have specific, opportunities in this area to be able to place in front of them for subsequent grants? And then my second question is more the logistics with the board. What does this time frame look like? Because you had mentioned that it needs to be a letter from us. It needs to be pretty much before the Thanksgiving holiday. We have one meeting, sometimes some of us a month. But what is that letter comprised of? Is it actual physical signatures? Can it be an e-signature? How many people? Does there need to be a quorum from the board? So those are two of my questions. Thank you.
The first question, I think they put this grant forward because right now HUD is really promoting permanent supportive housing, and we just don't have enough capital projects around the country for it. And so they recognize that there was a gap there, and so they put this forward. I can't answer whether they'll put it forward again. I think they'll look and see how much this fills that gap. My guess is it won't, because as we all know, almost every community in the country needs permanent supportive housing. So will they put it forward again? I just can't answer that. I just don't have any information. And then regarding the timing, the plan, which I did bring to the co-chairs at the September co-chair meeting, was that I would present that letter to the board at the November meeting and have it ready to be signed. I think it just has to be signed by the co-chairs, and I think it is just an e-signing. It's all in e-snaps, the grant online thing. So I don't see any problem with getting the letter signed in time for the grant to be filed November 21st. But those are good questions, and you're raising my blood pressure bringing them up. But I no,
I do have another quick logistical question on the board side. Is this letter going to be accessible to us, you know, privately, publicly, so that we know what it is that we're all in union of approving things?
Certainly, yes. So the letter will say, this CoC has a project that meets this very strict criteria. The project is Project X, and we want to put this forward for the CoC Builds Grant application, and then the signature. It'll be like 4 lines. It's not going to be long, and it'll just be attached to the grant narrative, which in the grant narrative really drills down, you know, how many people is this going to serve? Who is the provider? How many other projects have they done? Show due diligence that the projects that they've done in the past have done, you know, they've done an excellent job. So that's what the grant narrative will say. And we will certainly, I will provide the grant narrative to the CoC board when we submit it November 21st. It'll be available to the whole board. Does that answer your question? You just jumped in my screen there, Bella. Did that answer your question?
Yeah. Thanks. We have a few questions in the room. TT?
Hi, Monica. I was wondering, as far as applicants go, is it restricted to nonprofits only, or are local governments able to apply?
It's restricted to nonprofits, I believe. I'm hesitating a little because can I get back to you on that? Alex, can you take notes and I will, let's drop something in the chat on that and I'll get back to you on it. The NOFO is in the memo, and I just want to read it. I want to make sure I'm answering you accurately, but I'm pretty sure it's restricted to nonprofits.
Okay. Thank you for that.
Thank you.
I had a quick question. Oh, sorry, go ahead.
I just want to say I will get back to you for sure through Catherine.
Thank you.
I see a couple other hands outside the room, Amy and Tamara.
Yeah, really quick, I had one more question. Sorry, just a really quick, easy one. That's okay. You mentioned that there won't be a cost, or it's just for the building, correct? So how would the program then cover the cost of the facilitation, or like running the building? Would that be then up to them, or would that be something that we would need to be looking at for the NOFO?
coming years. If you have any insight, if you need to, just let me, yeah, thanks.
Yeah, sure. So, all the work you guys just did on allocating the regular CoC funds, that's paying for, rapid rehousing, just like Kelsey went through the permanent supportive housing, rapid rehousing and all of that stuff. And so PSH, permanent supportive housing providers are going for funding through HUD, through the regular CoC process, and then any other state or local process that they can.
Okay. Well, hopefully we have more funds for that.
Yeah.
Did we want to move to Cameron?
Sure.
Yeah, I was just curious if you could speak a little bit more about the criteria and selection process for who would be up or doing the build, or who I guess makes the ultimate decision. And is the public involved in the development of the grant or the policy development of the building or anything outside of just the brick and mortar? Just
So the King County, the housing department at King County is in charge of overseeing most of our building of permanent supportive housing. So anybody who's building permanent supportive housing goes through King County to get that done. And so they have the list of the whatever, say there's 6 projects currently that are being built for permanent supportive housing. And then they're just vetting each of those projects with a fine-toothed comb to see which is going to be our strongest applicant. And I can put together another memo that outlines more clearly the criteria that they're using, but it's like the building needs to be 42% or more built. The building needs to be, it's like that level of strictness, which seems a little, maybe not that level, but almost that level. So we're really just trying to drill down on the project that we have in the works to figure out the one that most aligns with what they're looking for. It's kind of just, it's like a little game, honestly, just trying to figure out, okay, what's the project that we have that's most going to meet those criteria? And that's what we're doing right now.
Right. And once the provider is selected, is there anything follow up with, or once there's no provider?
So it's not we're not looking for service provision. That's not the thing where it's for the building.
Just the building, just
yeah,
the building
but
only, nothing else. Okay.
so, but the builder, the providers are the ones who are building the buildings, but we're not picking the provider per se. We're just picking the building.
Got you. Okay.
It's a very unusual HUD grant. And so it's very confusing because but we have to make sure that the provider aligns with all the criteria, like they've run 4 or more permanent supportive housing projects in the past. They've, whatever the other criteria. And I will definitely write a memo because you guys are very interested in it. Exactly, I'll put together exactly what this criteria is that they're looking for.
That'd be beautiful.
Yeah,
Thank
I'll get that to you all. I'll get it to Catherine and she can distribute it to you and Alex.
Thank you so much.
Oh, of course.
I saw Amy's hand, but it just went down. So I'm guessing they don't have a question any longer. But, all right, cool. Thanks, Amy. Is there any other questions? Oh, go ahead, Monica.
Yeah, I just want to say thank you all for these really, really great questions. I really appreciate your interest in this project, and I will get a second memo out to you, just drilling down on some of these questions. So I owe you that, and expect a letter at your November board meeting that gives outlines what we talked about. And if there is any issues that we either don't have a project that fits the criteria or we have too many projects, then I will be working with the co-chairs on that. And I guess the co-chairs would decide if we needed to have a special meeting. But I think what we're really going to do, what our goal is to just drill down and find the absolute best applicant we can so we can get this money, or we can hope to get this money.
Awesome.
Thank you very much. Anything else?
No, just thank you so much, Monica. We really appreciate the engagement here on the questions
and this is Ruby, I didn't say that at the beginning for the captioner. Just wanted to say thank you so much. We look forward to hearing more about that coming up, and also that, you know, anyone on the board is more than welcome to give input on anything that we're gonna be discussing here, and we can bring it to Monica for any questions you might have. If it does come down to her working with the co-chairs, of course, we're gonna be inclusive of everybody's input, and would rather it be that way too. So just throwing that out there, that everybody should feel empowered to speak their mind on what we're doing here. So thank you so much. Yeah, and I was gonna give a couple shout outs. I first wanted to acknowledge that we did get a vote from Christina on the priority ranking list. So we are now at 13 yays. So that's good. That's a unanimous vote for Kelsey. And then also wanted to give a shout out to everybody on the call today. We did it. We got our first meeting with every board member present. So that's a big attendance key for us. And we've been looking for something like that. I know Tamara's excited. And so we're very happy to announce that. We've got a couple board meeting members in person too. So anybody that wants to come in person, there's a couple more seats available in the room. And yeah, we did good. We're ahead of schedule. You're gonna get a whole 11 minutes back in your day, so use that wisely. And we look forward to seeing you guys at the October 24th meeting at 3 p.m., which is a Thursday. That's different than our usual meeting day. So just throwing that out there. Yeah, any other questions, any closing thoughts before we adjourn the meeting? All right, not hearing any. Oh, Dorsal, go ahead.
Yeah, I just wanted to make an announcement because I think this is really good information to share, and it ties into the last presentation in particular. But if you're not aware, Washington State has launched a program now where there's an email you can reach out to if you are a provider who is attempting to build, receive permits, or site an emergency shelter, transitional housing program, or any other what is being called STEP. And so I would share that information far and wide. It's only available till June of 2025. But if you know a provider who's been trying to get an emergency shelter, transitional housing, or other program going, and they haven't been able to because of barriers at the government level, there's potentially an option available for them.
Wow, it's great information. We'll definitely look into that. I think all of our ears just perked up in the room. So thanks for that, Dorsal. All right. Any other questions, thoughts before we adjourn?
This is Elizabeth. I noticed something before we started that said we meet monthly and we are allowed 19 meetings. How many meetings have we had so far?
Oh, are 19 meetings or members? Maybe?
There was something up there about.
The board can be up to 19.
Yes.
Oh,
So
how
far along on that are we?
Oh, well.
We have 13 board members.
19 members, not
Yeah.
meetings.
Yeah,
Oh,
not meetings.
yeah.
Oh,
Board
I'm
members.
sorry.
Good clarification question there though, because I was thinking, oh man, how many meetings have we had, you know, like. So
All right, thank you.
Okay, cool. Yeah, so we still have a few board member seats open. That is something good to keep your finger on the pulse of. All right, cool. So I wanted to also inform everyone that we're doing our written updates for our work groups and our committees on the meeting materials. I believe it was in the meeting materials, or will be.
It's posted on the website. It's separate from the meeting. It's in there. Yeah.
Awesome. We have those separate from the meeting materials on our website if you wanted to read about our committee and work group updates that we have written there. So just a FYI. All right, that's it. You guys are free to go. Now you get the next 8 minutes back. The meeting's adjourned.
Thank you, everybody.